Good morning, friends. Welcome to today's talk. It was the time when I had just joined as the research officer in the Department of Medicine at All India Institute of Medical Sciences. I happened to go to a school in Delhi to meet the principal. The principal was a Punjabi lady married to a Bengali gentleman. She casually mentioned me that last week her husband developed fever, cough with sputum production and difficulty in breathing. So he had to be admitted in a nursing home where he was given glucose in the form of infusion and certain injections were given by intravenous route. He was kept in the nursing home for 4 to 5 days. He improved and finally sent home. No, he is okay. His X-ray showed a shadow in the left lung. I, showing my humanly concern, asked her, had the shadow in the left lung disappeared? She did not appear to understand. She said, I do not know, but what does it mean? I explained to her that there might be a lesion in the lung which was not causing symptoms or signs. It was a silent lesion on which infection occurred and it became large in size and started producing symptoms and signs like fever, cough, expectoration, and other physical signs. Difficulty in breathing also. So it is important to see whether this underlying lesion has disappeared or not. Then she asked me, what should I do now? I told her, you get another X-ray done. And when the X-ray was done, it showed a cone-shaped shadow in the left lung. It was of the size of an old 1 rupee coin, which was larger than the present coin. So next question came, what to do? So I told her to go to All India Institute of Medical Sciences in the chest clinic and he will be taken care of. She brought her husband and we admitted him in the Department of Medicine dealing with chest diseases. We did bronchoscopy, we did repeated sputum cytology for malignant cells and ultimately established the diagnosis of squamous cell carcinoma of the lung. Friends, there are two types of lung cancers: small cell lung cancer and non-small cell lung cancer. Non-small cell lung cancer is of 3 different types: squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Now, having established this diagnosis, the question was what to do. Naturally, the answer was that it has to be operated. But the patient was very sensitive. He was a heavy smoker. He requested us that he is feeling homesick and wants to go home and would like to come after 2 months when there will be summer vacation in school and his wife will be able to attend to his needs. After 2 months, they contacted me. This time he was admitted in the private ward. Let me tell you, friends, over this duration, the husband and wife had become very close to us. So we daily used to visit them in the private ward. My wife used to accompany me. We sent a consultation to the surgery, to the cardiac thoracic surgery ward, but for some unknown reasons, this kept on postponing. Finally, the patient was taken for surgery. He was given anesthesia, but the result was the patient developed cardiac arrest. मर गया patient. They quickly opened the chest and gave directly shock to the heart. Still, the patient could not be revived. I was feeling very bad about it, but what had happened? This smoking could have caused coronary artery disease in the patient. It could have caused changes in the myocardium. It could have precipitated malignant arrhythmias resulting in cardiac arrest. So it was all a matter of speculation. But I will concentrate on the cancer of lung, and then I want to show you some diagrams and figures and photos to make you understand this thing. Now look at this X-ray of the chest. See, this is the right side. This is the diaphragm on the right side. This is the diaphragm on the left side. This shadow is the heart. From here, this is all, the shadow is the heart. This part is, called mediastinum. This is the part behind the breastbone. I had told in my last lecture that this part is called mediastinum, and this is the prominence which we commonly see in X-ray. This is the pulmonary artery. We call it pulmonary conus. See in the left lung, this white area in the left lung. This I am outlining it with my pencil. This is abnormal. This is homogeneous. It is non-homogeneous because there is a black area here also. If this black area was also not there, if it was all white, we will call it homogeneous opacity. But it is not all white, therefore we are saying it is a non-homogeneous opacity. Now this is a cavity which is, we are seeing air in the cavity in the white area itself. This white area is called consolidation, which occurs mostly due to the infection. Now see the other diagram for better understanding. This is the right lung, this is the left lung, this is the heart, and this is the diaphragm separating from abdomen from the chest. Now what is there in the right lung? If you see, this is mark number 1. This is a opacity. This is unilateral hilar lymphadenopathy. This one is unilateral hilar lymphadenopathy. If we go higher up, we find these two linear or vertical, you can call them, opacities here, and in the center you see this hollow tube. This is the windpipe or trachea. हमारे सांस की नली ये है, इसमें से हमें सांस आता है और ये हवा फेफड़ों में चली जाती है. The air goes through this trachea into the left and right lung. These lymph nodes are called paratracheal lymph nodes. If you go further, you see in the left lung this rounded opacity. This is primary pulmonary opacity. This is also a part of lung. Further, as you go down in the left lung, you find a opacity in the left lower part towards the outside with a line gradually going up. It is a slanting line. This is what is called as the pleural effusion. Now if you go to the right side again, you find this wedge-shaped shadow. This is the collapsed lung or lung segment or a lobe. If you go up higher, you find a rib which is broken. It is all because of the cancer. If we see the heart, see this line showing. See, now it is more clear. See this line. This between the heart line, this is the border of the heart, and there is another line which is making like this. This is called pericardial effusion. Around heart की झिल्ली में पानी चला गया. This is called malignant pericardial effusion. If you see another diagram, see this. This is left lung, this is right lung. And see now closely. This portion marked T is trachea, called windpipe. And this is all, instead of going like this along this line, it should have been like this line, but it has gone here like this. This is shifted from the left center to the right side. If so, you see this is the heart. This is also shifted to the right side. If you see this diaphragm, this is also pulled up. This is the reason is behind this is the collapse of this lung, which resulted in loss of the volume of the lung, and this has created these changes pulled it over. But if you look at the left side, this appears to be larger. It is because there is a compensatory emphysema. What is emphysema? The alveoli or air sacs of the lung, they become larger, and some of them they break, resulting in large areas of air containing areas, but practically non-functioning. So friends, having understood that this is the cancer of lung, so friends, when this patient came to us after 2 months, he was admitted in the private ward and a consultation was sent to the thoracic surgery department, and patient was taken for operation, and unfortunately the patient developed cardiac arrest right when he was given general anesthesia. His chest was opened, direct shock to the heart was given, but patient could not be revived. Practically काम खत्म हो गया. The patient is gone. Now what has happened? The patient was a heavy smoker. His smoking might have led to the coronary artery disease. Smoking might have produced changes in the myocardium. Smoking might have induced tachyarrhythmias resulting in cardiac arrest. Whatever may be the reason, we are just speculating. But I want to tell you here something about the cancer of the lung. Cancer of lung is 10 times more common in smokers than in non-smokers. Some changes in the genes are produced by smoking. It has been estimated that for every 15 cigarettes smoked, one gene change is introduced. I may let you know that gene change means that this changed gene can transform normal cells into the cancerous cells. If the person stops smoking, the risk becomes lower. Still, in non-smokers, cancer is 9 times more common than in those who have never smoked. There is also a risk from the environmental smoke, what is called second-hand smoke also. There are many studies on this thing, but lung cancer is uncommon below the age of 40 years. From 40 to 80 years, incidence goes on increasing, and after the age of 80 years, the incidence starts decreasing. The risk of lung cancers is higher in those who take less vegetables and fruits during their adulthood. Some nutrients in the diet, in the food, like retinoids and carotenoids, they do have preventative effects on the cancer. Even if the diagnosis of cancer is established, still the smoking should be stopped, and every physician and every person should make it a point to stress on the patient that smoking must be abandoned. Cutting smoking does not help. It is the total stoppage of smoking which does some benefit. Now, what benefit it gives is the quality of life is improved by stopping smoking. The side effects of the therapy become less. Quality of life is improved. And smoking causes changes in the metabolism of drugs, so that the side effects are marked. So if a person stops smoking, these changes will not occur and the side effects will be less. So friends, I will say sufficient for today, and I will sum up today's talk by saying that cancer of lung is reasonably common. Between the incidence goes on increasing between 40 and 80 years of age. Some varieties are more common in men, like squamous cell carcinoma, and some are more common in female, like adenocarcinoma. Squamous cell carcinoma is uniformly associated with smoking by the people, whether primary smoke or second-hand smoke. The smoking in addition can cause cardiovascular effects. Therefore, even in established cases, smoking must be stopped. Remember, cutting smoking does not help. So friends, that's for today. Please do like my video, comment, and if you have not subscribed, subscribe my video. Please, if you want to receive intimation about the future videos, click the bell button. Thank you very much.